Thyroid surgery. So from this topic, your main questions are framed from the complications of your thyroidectomy. So but before going to that, let's look at this important table which has been given in your Bailey and Love. So all thyroid operation can be assembled from your three basic elements, that is your total lobectomy, isthmusectomy and subtotal lobectomy. So what is your total thyroidectomy? So total thyroidectomy is two lobectomies and isthmusectomy. Then what is your subtotal thyroidectomy? Your subtotal thyroidectomy is your two subtotal lobectomy plus isthmusectomy. Then your near total thyroidectomy is total lobectomy plus isthmusectomy plus subtotal lobectomy, which is also known as your Dunhill procedure. And lobectomy is your total lobectomy plus your isthmusectomy. So these are your few definitions which can be asked in your exam as your one-liners or as match the following. Now regarding your complications of your thyroidectomy, we have first your injury to parathyroid. They usually occur 3 to 5 days after your thyroid surgery, presents with your tingling sensation and your twitching. Now, low level of calcium can cause your circumoral numbness, digital numbness, and you have your two signs which are associated with your hypocalcemia level, that your Schwarzschild sign and your Trousseau sign. Then you have your nerve injury associated with your thyroidectomy. So you have your superior laryngeal nerve injury which causes your loss of timbre of voice. Now this is much more commonly important when you have your patients who are singers by professionals. So if the injury to the SLN nerve occurs, then they would lose the timbre of their voice and they will not be able to change the pitch of their voice. Then you have your recurrent laryngeal nerve injury. Again, this would be coming important in your singers because a unilateral recurrent laryngeal nerve will lead to your hoarseness of voice, and your bilateral recurrent laryngeal nerve injury can lead to your distress, cyanosis and your vocal cord palsy. Now regarding your hemorrhage, so this is one of the most frequent life threatening complication. So you have your primary hemorrhage which occurs intraoperatively. Then you have your secondary hemorrhage. This usually occurs 7 to 10 days after your surgery, usually secondary to your infection. Then you have your reactionary hemorrhage. So this usually occur within 24 hours of surgery, usually due to the ligature slip. Which you have your reactionary hemorrhage. Now, one of your most common questions that have been asked from this section is that if your hematoma develops while you are on your evening round, what will be your first step that you do? The first step is to open your sutures or the clips, and this can be done bedside, and then you follow your other treatment protocols. So this is with respect to your complications of thyroidectomy, where you have first important injury to parathyroid, then you have nerve injury and hemorrhage, mainly a primary, secondary and reactionary. And if a hematoma develops, the first step that you as a intern on call or a ward duty on doctor on call would be to relieve the hematoma impaction over here by opening the sutures or the clips that have been placed. Thank you.